Hi, I'm Shawan with Dayton Trichology Hair Loss Control Clinic. Today I'm going to talk to you about non-surgical hair replacements. These hair replacements are replacements for women that are experiencing a scarring alopecia, meaning that for some reason or another they have a type of hair loss that we cannot get their hair to grow back. Hair loss treatments are not an option for them, or either they've been a burn victim or a situation where there's no way that the hair can grow back. Sometimes it's a situation where women just want fuller hair, or they just need to fill in a certain area of their scalp and they don't need to fill in the whole entire scalp. Whatever that situation may be, we have several different options here. Once again, I want to repeat that non-surgical hair transplants are for women that A, have either scarring alopecia, meaning that they have a form of hair loss and that the hair cannot grow back in. B, a woman that has had an accident, a car accident, or a burn victim, and a piece of their scalp has been torn and it cannot grow back in. It's also for women that just want fuller hair, or that they're women that are experiencing hair loss in an area that's just a small section and they don't want to wear a wig to cover the whole entire head, but they want to cover that area that they're thinning in. So let me talk to you about the different types of hair replacements that we offer here at Dayton Trichology Hair Loss Control Clinic. The first one is called a full top. The full top is actually a hair system that's designed to cover just the top of the head. This hair system is for a woman that only is experiencing hair loss in the top, and actually she's at a point to where the whole entire top of her head is experiencing extreme thinning. And so this is a system that has a base that will cover that area. The next one I want to talk to you about is what's called frontal hair loss. This is what's called a lace front. This is for a woman that actually is just experiencing hair loss around the perimeter. The lace gives her a natural hairline. As you can see, the hairs look like they're growing from the scalp, but it gives her a natural hairline. If you're a woman that's experiencing frontal fibrosing alopecia, or you have a traction alopecia that you've been experiencing for years, and that traction alopecia will not allow your hair to grow back around the perimeter, this is the hair system for you. And once again, this is a frontal hair piece. The next one that we're going to go over is what's called an integration. This integration is just a system for women that want to make their hair longer and fuller. Maybe you're experiencing diffuse thinning. And so with this system, we can take and integrate your hair in with this system and make it thicker. So it's just for a woman that's experiencing more of a hair loss that's going to make their hair thin, and they just want to make their hair fuller. Now with all of these systems, you can get your hair system designed for the thickness that you want, the thinness that you want, the texture that you want, the color that you want. They're totally undetectable. You can't tell that you're wearing a system. It looks like it's your own natural hair. We match the color, the density, the texture, and the size. It's the most beautiful system that you'll ever experience. This one right here is called a central. I call it a central system. This is for a woman that's experiencing CCCA. That's more of a system that we use just for the center of the actual scalp, and it looks like this in the center. The reason why it looks like this is because the woman is experiencing hair loss right here in the center, but we can integrate the hair through the other areas. And I use this for more of a patient that has CCCA, and it's going to help them with the central region to help them integrate their hair only in that area. This next system is what I call just the top system. This is a very small system for a woman that's experiencing hair loss at any area in her scalp. It could be on the right side, the left side, the top, or the back. This is a small system. We actually designed this system for that particular area. It's kind of like making a piece to a puzzle. So if your area is a U shape, it's made in a U shape. This is all 100% hair. If you look at it, it looks just like your scalp. So this is more of a small system that we use in any area that you're experiencing hair loss. It could be over in the right lower side, the top, it could be in the back. And this is called, for me, I use the name of central system because this is for any area. And we make it like fitting a piece of a puzzle to the scalp. The next one is going to also be a hairline system like the one I showed you before. The thing about the other one is that it had more of a natural hairline. It had little baby fine hairs. Sometimes they call the other one a hairline 360. This one's just basically for the perimeter in the front of the hairline. As you can see, it's not as wide. It's really fine. It's just going to cover right in the front for those ladies that have traction alopecia and also frontal fibrosing alopecia. This one here is a little wider, so you see the difference. One is a little finer and one is a little wider. We have so many different options for women that are experiencing hair loss, and they're totally undetectable. You can order them and have them designed in any size, any color, any density, and it's totally natural looking. You don't shampoo it and take it off. It's there. You can go swimming, exercising, and it matches your hair. A lot of times when I do consultations for women that are looking at having a hair replacement consultation, I'll have you bring in pictures of your hair when it was at the point that you just loved it. And then we duplicate it. We duplicate that exact hairstyle. This next one is just a hair system that I use for women that are completely thin in the top, or they have no hair in the top. And for those women that are at a more advanced stage of hair loss, this gives them a natural look. And once again, it gives you a natural hairline. So once again, these systems are for women that are experiencing hair loss that have what we call a scarring alopecia, for women that have been in car accidents or burn victims, and there's no way that any type of treatment that you're going to get is going to cause your hair to grow back. Here at Dayton Trichology, we want to make sure that we're able to accommodate any patient that comes in. We offer non-surgical hair loss transplants, and also we do trichological hair treatments for women that are experiencing thinning, and we can stabilize and reverse your hair loss. But there are some cases where you just can't get that hair to grow back in, and that's more of a person that has been dealing with, like I said, a bad car accident, or that has been in a burn situation, a fire or a burn victim. And then women that are experiencing traction alopecia that is at a point to where you can't reverse it. Once again, all of these systems are really natural looking. You can shampoo your hair, you can go swimming, you can exercise. You don't have to worry about taking these systems off. If you're interested in coming in for a non-surgical hair replacement consultation, please give us a call at Dayton Trichology, which is 937-281-0555, or you can go online at www.DaytonTrichologyHairLossControlClinic.com. My name is Gullette. I'm with Dayton Trichology. We look forward to hearing from you soon. Thank you.